So for Asian blepharoplasty, there are different methods in which we can create a double eyelid. And creation of the double eyelid means that there is a connection of the skin with the underlying cartilage and muscle, so that when we actually open our eyes, the skin kind of invaginates in and thereby forming that crease. For a lot of, especially Eastern Asians, just naturally they don't really have a double eyelid. And so surgically what we're trying to do is recreate that attachment between the skin, the cartilage, and the underlying muscle. And there are basically three different methods. One is completely scarless, just suture technique. So what we do is that we kind of like evert the eyelid, and then just using sutures, we create that crease. It's rare that we really have patients who is a candidate just for that, because with a suture technique, the main way in which that double eyelid will fold and keep it kind of connected is the scar tissue that it forms. And when we use suture technique, we don't create enough of that kind of the raw surface area and internal scar to create a double eyelid that will last a lifetime. So for a lot of patients, they're really not a candidate for just suture technique. The second method is what we call minimal incision, which means we make between 3 to 5 very small incisions at the level in which we want the double eyelid to be. And then we use sutures to create that double eyelid. Because there is a minimal sort of incision, that fold is more stable. However, even with this method, especially if you have kind of a thicker skin or a lot of like fat, we can't really say that it's going to be permanent. And finally, the last technique is a full incision technique. And I would say good 60-70% of our patients are more candidate for a full incision. Because even for younger people, there always is a little bit of that extra skin that kind of hoods over the eyes that makes the eye look smaller. And so if we can cut out that extra skin, it always kind of like kind of rejuvenates the eyes more. But the main reason to do a full incision is that double eyelid is very stable. Because we're actually cutting along that double eyelid crease, it creates a larger surface area for everything to sort of stick down. And so that double eyelid becomes more permanent. So these are the three main methods of performing an Asian blepharoplasty and creating a double eyelid: suture-only technique, minimal incision technique, or a full incision technique.